high again. We're going to look at the features of the X-ray set that can be optimized to keep the dose as low as reasonably practical when you are taking a dental radiograph. The first thing to look at is the kilovoltage. This has to be just right. 60 kilovolts is recommended as the kilovoltage of choice for dental intraoral X-ray sets using DC, direct current equipment. New sets should be DC. When the kilovoltage is too high, very energetic X-rays are produced, which form a low contrast image and cause more DNA damage. When the kilovoltage is too low, the X-rays are too weak to properly penetrate the body and reach the sensor or film. So that's kilovoltage. It has to be set right. The next thing to get right is the filtration. Filtration by aluminium is a key method of reducing skin dose to patients. X-ray sets produce a full range of soft and hard X-rays. At least 2.5 mm of aluminium is required for dental sets. This removes many of the soft X-rays. As I've just said, soft X-rays are unwanted. They are fully absorbed by the patient before they reach the sensor or film, so they do not help form the image, but still cause DNA damage. Rectangular collimation is a highly effective means of dose reduction in intraoral dental radiography. It should be used in combination with film holders incorporating beam aiming devices. Collimators must be used in conjunction with film holders and tube positioning devices. Slight errors in positioning will instantly result in the film being partially coned off. They can be retrofitted to most dental sets that do not have one already. If available, limitation of field size to the area required for diagnosis should be used for panoramic radiography. The length of the positioning tube is important. The further the patient is from the X-ray source, the more parallel the beam will be. This gives less magnification of the image. However, the further away they are, the more powerful the beam has to be, as the beam strength diminishes according to the inverse square law. This is called the focus to skin distance. A balance needs to be found between distance and power. The minimum focus to skin distance is 20 centimeters. This distance is maintained by the positioning tube that emerges from intraoral sets. All these features tend to be built into the machine by the manufacturers. However, different views on different patients can require different doses to produce an image. For example, an anterior periapical on a child requires less radiation than a bite wing on an adult. With a DC intraoral set, the dose for an adult can be increased by increasing the current, milliamps, or increasing the exposure time. With a panaural set, the dose is usually adjusted by increasing the kilovoltage. In the next lesson, we'll have a look at how to optimize panoramic, or OPG sets.